Cancer, a disease that profoundly affects not only the body but also the mind and spirit, brings with it a host of challenges that extend far beyond the reach of conventional medical treatments. For those navigating the complexities of cancer, palliative care emerges as a beacon of holistic support, focusing not just on prolonging life, but on enhancing its quality. This specialized approach to care is designed to alleviate suffering in all its forms: physical, emotional, social, and spiritual, ensuring that patients and their families find comfort, dignity, and meaning even in the face of serious illness. At its core, palliative care is centered on the principle of patient-centeredness. Unlike traditional curative therapies that target the disease itself, palliative care addresses the person as a whole. It begins at diagnosis and can be provided alongside curative or life-prolonging treatments, ensuring that support is available at every stage of the cancer journey. This early integration is crucial as it allows for the timely management of symptoms and side effects, which are often significant hurdles for cancer patients. Pain, fatigue, nausea, breathlessness, and other distressing symptoms can severely diminish a patient's quality of life. Palliative care teams employ a range of strategies, from pharmacological interventions to complementary therapies, to manage these symptoms effectively, allowing patients to maintain greater independence and participate more fully in daily activities. Beyond physical symptoms, cancer exerts a profound psychological toll. The diagnosis itself can trigger anxiety, depression, fear, and existential distress. Palliative care recognizes the intricate interplay between mind and body, offering counseling, psychological support, and interventions tailored to each individual's needs. By providing a safe space for patients to express their emotions and fears, palliative care professionals help mitigate the emotional burden of cancer. This support extends to family members, who often grapple with their own feelings of helplessness and anticipatory grief. Through counseling, education, and open communication, palliative care empowers families to cope more effectively, fostering resilience and unity during challenging times. Social factors also play a pivotal role in the cancer experience. Financial concerns, changes in employment, altered family dynamics, and social isolation can exacerbate suffering. Palliative care teams, typically composed of doctors, nurses, social workers, chaplains, and other specialists, collaborate to address these broader determinants of well-being. Social workers assist with navigating insurance issues, accessing community resources, and planning for future care needs. By addressing such practical concerns, palliative care alleviates stressors that might otherwise detract from a patient's ability to focus on healing and meaningful experiences. Spirituality, too, is an integral aspect of palliative care. For many, facing a life-threatening illness prompts deep reflection on questions of purpose, legacy, and faith. Chaplains and spiritual care providers offer guidance and companionship, respecting diverse beliefs and traditions. Whether through prayer, meditation, rituals, or simply attentive listening, spiritual care helps patients find comfort, hope, and reconciliation. This dimension of care is particularly important in end-of-life situations, where existential distress can be acute. By supporting spiritual needs, palliative care fosters a sense of peace and acceptance, enabling patients to approach the end of life with dignity and grace. Communication lies at the heart of effective palliative care. Open, honest, and compassionate conversations about prognosis, treatment options, and patient preferences are essential for shared decision-making. Palliative care teams excel in facilitating these dialogues, ensuring that patients are fully informed and empowered to make choices that align with their values and goals. Advanced care planning, including discussions about living wills and do not resuscitate orders, is encouraged early in the course of illness. This proactive approach not only clarifies expectations, but also reduces uncertainty and conflict during critical moments. A key benefit of palliative care is its adaptability to individual needs. Each patient's journey with cancer is unique, shaped by personal history, cultural background, and family circumstance. Palliative care respects this diversity, offering personalized care plans that evolve over time. Regular assessments allow the team to respond promptly to changing symptoms, preferences, and goals. This flexibility ensures that care remains relevant and responsive, enhancing both patient satisfaction and clinical outcomes. The integration of palliative care into oncology has been supported by a growing body of evidence. Studies have demonstrated that patients who receive early palliative care experience better symptom control, improved quality of life, and even, in some cases, prolonged survival. They are less likely to undergo aggressive interventions at the end of life, such as unnecessary hospitalizations or intensive care admissions, which may not contribute to meaningful benefit. Instead, they are more likely to spend their final days in comfort, surrounded by loved ones, with their wishes honored. This shift from a purely disease-focused model to one that prioritizes quality of life reflects a broader evolution in healthcare, recognizing that the ultimate goal is not merely to extend life, but to enrich it. Palliative care also plays a vital role in supporting caregivers. Family members and friends who assume caregiving responsibilities often face significant physical, emotional, and financial challenges. The demands of providing care can lead to burnout, strained relationships, and neglect of one's own health. Palliative care teams offer education, respite, and emotional support to caregivers, acknowledging their essential contribution to the patient's well-being. By addressing caregiver needs, palliative care promotes a healthier, more sustainable caregiving environment, benefiting both patients and their loved ones. Another important aspect of palliative care is its emphasis on continuity and coordination. Cancer care frequently involves multiple specialists, complex treatment regimens, and transitions between care settings. Palliative care teams act as navigators, coordinating services and ensuring seamless communication among all providers. This integrated approach reduces fragmentation, minimizes errors, and enhances the overall patient experience. Whether care is delivered in hospitals, clinics, hospices, or at home, palliative care maintains a consistent focus on the patient's goals and preferences. For patients with advanced or metastatic cancer, palliative care becomes especially crucial. As curative options become limited, the focus shifts increasingly toward comfort, symptom relief, and psychosocial support. Hospice care, a subset of palliative care, is specifically designed for those nearing the end of life, offering comprehensive support in the final months or weeks. Hospice teams provide round-the-clock care, pain management, and emotional and spiritual support, allowing patients to spend their remaining time in familiar surroundings, free from unnecessary interventions. This approach honors the inherent dignity of each individual, affirming that every moment of life has value. Palliative care's holistic philosophy extends to bereavement support for families. The death of a loved one is a profound loss, often accompanied by complex emotions and adjustment challenges. Palliative care teams offer grief counseling, support groups, and follow-up services to help families navigate the grieving process. This ongoing support fosters healing and resilience, reinforcing the notion that palliative care's impact endures beyond the patient's life. Cultural competence is another hallmark of effective palliative care. Recognizing and respecting cultural differences in attitudes toward illness, suffering, and death is essential for building trust and delivering appropriate care. Palliative care providers receive training in cultural sensitivity, ensuring that care is tailored to the beliefs, values, and traditions of each patient and family. This respect for diversity enhances communication, strengthens therapeutic relationships, and ensures that care is both effective and meaningful. In recent years, advances in technology have expanded the reach of palliative care. Telemedicine, remote monitoring, and digital health tools enable palliative care teams to support patients in their homes, reducing the need for travel and hospital visits. This innovation is particularly beneficial for those in rural or underserved areas, where access to specialized care may be limited. Virtual consultations, symptom tracking apps, and online support groups have become valuable adjuncts to traditional care, enhancing accessibility and convenience. Education and advocacy are integral to the growth and effectiveness of palliative care. Many patients and families are unaware of the availability and benefits of palliative care, often associating it solely with end-of-life situations. Healthcare providers play a crucial role in dispelling myths, raising awareness, and initiating timely referrals. Ongoing education for clinicians ensures that they possess the skills and knowledge necessary to deliver high-quality palliative care. Advocacy efforts at the policy level aim to expand access, improve funding, and integrate palliative care into standard cancer care pathways. The economic benefits of palliative care are increasingly recognized. By preventing unnecessary hospitalizations, reducing emergency room visits, and minimizing the use of costly interventions, palliative care can lower healthcare expenditures while improving patient outcomes. Cost savings are achieved without compromising the quality of care. Indeed, patients report higher satisfaction and better overall experiences. This alignment of clinical and economic goals makes palliative care a valuable component of sustainable healthcare systems. Research continues to uncover new insights into the mechanisms and benefits of palliative care for cancer patients. Studies explore novel approaches to symptom management, the impact of early integration, and the experiences of diverse patient populations. Patient-reported outcomes, qualitative research, and randomized controlled trials all contribute to a growing evidence base. This commitment to scientific inquiry ensures that palliative care remains dynamic, evidence-based, and responsive to the evolving needs of patients and families. Children and adolescents with cancer also benefit from palliative care, though their needs may differ from those of adults. Pediatric palliative care teams are specially trained to address the developmental, emotional, and family-centered aspects of care for young patients. Play therapy, educational support, and age-appropriate communication are integral components, helping children understand and cope with their illness. Support for siblings and parents is equally important, recognizing the profound impact of childhood cancer on the entire family unit. The ethical framework of palliative care emphasizes autonomy, beneficence, non-maleficence, and justice. Patients are encouraged to participate actively in decisions about their care, with respect for their values and preferences. Palliative care teams advocate for interventions that maximize benefit and minimize harm, avoiding unnecessary or burdensome treatments. Equity and access to palliative care services is a guiding principle, ensuring that all patients, regardless of background or circumstance, receive compassionate and appropriate care. Palliative care is not a one-size-fits-all solution. Rather, it is a dynamic, individualized approach that adapts to the unique needs of each patient and family. Its success depends on skilled, compassionate providers who are committed to holistic care. Interdisciplinary teamwork is essential, drawing on the expertise of physicians, nurses, social workers, psychologists, chaplains, and others. Collaboration and mutual respect within the team foster a supportive environment, enhancing the quality and consistency of care. The narrative of cancer is often framed in terms of battles and victories, but palliative care invites a different perspective, one that acknowledges vulnerability, fosters connection, and celebrates the richness of life, even in the face of adversity. By prioritizing comfort, dignity, and meaning, palliative care transforms the cancer experience, enabling patients and families to find hope and healing amidst uncertainty. In summary, the benefits of palliative care for cancer patients are profound and multifaceted. It offers comprehensive symptom management, emotional and psychological support, social and practical assistance, spiritual care, effective communication, and coordinated patient-centered services. It empowers patients to make informed choices, supports families and caregivers, and honors the values and wishes of each individual. Through its holistic, adaptable, and evidence-based approach, palliative care enhances quality of life, fosters resilience, and affirms the inherent worth of every person affected by cancer. As the field of palliative care continues to evolve, its integration into cancer care will become increasingly vital. Ongoing research, education, and advocacy will drive improvements in access, quality, and outcomes. Ultimately, palliative care embodies the highest ideals of medicine: compassion, respect, and a commitment to alleviating suffering in all its forms. For cancer patients and their families, it offers not only relief from pain and distress, but also the possibility of peace, fulfillment, and connection, reminding us that even in the shadow of illness, life can be lived with courage, grace, and meaning.